Hi, welcome to the CARE4U2 conference. Thank you so much for joining today. My name is Jerry Sullivan. I will be presenting on assessing and treating impulsive behaviors. I'm a licensed clinical social worker in Kansas and Missouri. I specialize in assessing and treating impulsive behaviors, as well as managing high-risk sexual behaviors, grief and loss support, anxiety and depression. I've been at Resolve for over 4 years now, but I've been in the mental health industry altogether for about a decade now. So yes, today we are going to be discussing assessing and treating impulsive behaviors. The objective for today's presentation will be to define impulsive behaviors, explore the DSM-5 diagnostic criteria, examine prominent treatment modalities, identify specific interventions, and then lastly, consider some of the pharmaceutical recommendations. Before we get going, I wanted to start by sharing a quote that I just think really encompasses people's struggles with impulsivity quite well. It's from Emmanuel Eco. He said, "Some people fail because they give up what they want most for what they want now." So we're going to start by trying to define impulsive behaviors. It sounds like it might be a pretty simple thing to do. You can just look up a definition. But if you're curious what that might be like, try to Google the definition of impulsive behaviors sometime, and you will find a wide variety of definitions for what this means and what this looks like. So the portion about defining impulsive behaviors is going to take some time today because it's a bit more layered than we might realize. So according to the DSM, impulsivity is recognized as a diagnostic criterion for several disorders, but the way it influences mental disorders and the development of risky behaviors is not yet clear. So you'll notice as you're going through the DSM and different disorders, impulsivity and impulsive behaviors is a symptom of several different disorders, which can make defining its origin pretty complicated. There's a lot of disagreement over the definition of impulsiveness. Its main components and measurement techniques make forming a comprehensive theory pretty challenging. And we'll get to that a little bit more later, and you'll have a greater understanding as to why. But for now, it's important to know that impulsivity has been investigated from various perspectives, and several definitions have been proposed, and we're going to go through all of them today. We're going to look at it through the behavioral, the cognitive, the biological, and the psychosocial components. So with those four components in mind, the behavioral, cognitive, biological, and psychosocial, let's look at some proposed definitions. So the first one is unplanned, risky behaviors that are harmful to themselves or others, a rash response in situations where a considerate response is more appropriate, lack of ability to evaluate the consequences of their actions, either for themselves or for others, learned behavior that is formed inside the family. For example, in family, children learn to react immediately in order to achieve what they desire, a coping mechanism to decrease emotional pain, or issues of inadequate attention. So there's the motor, the action without thinking, the cognitive, the quick cognitive decision-making, or the non-planning, which is decrease in orientation towards the future. So as you can see, that's a pretty wide range of what impulsivity could look like and how it might affect people. So that's kind of why, just one definition is challenging. But we are able to pull some core characteristics from all of the proposed definitions. So regardless the lens that you're utilizing to look at impulsive behavior, it will always include all four of the following. So the first one, it's behavior that continues despite negative or harmful consequences. 2, control over behavior may continue to decline consistently. 3, cravings or urges may occur prior to engaging in attempting behavior. And 4, some form of pleasure reward often accompanies the behavior. Before we continue, it is important to note that impulsivity is distinguished from impaired judgment or a compulsion, and we'll get into more detail about that later. But in those examples, some forethought has already taken place before the action. So with many impulsive behaviors, that forethought really has not occurred yet, but with impaired judgment or compulsion, it often has. Also, keep in mind, and I love using the first couple sessions about assessing and treating impulsive behaviors with clients, talking about this point in particular. Not all impulsivity is negative. Impulsivity is common and it can be developmentally appropriate among children and young adults, and even older adults sometimes as well. And it's often useful in certain situations. For example, impulsive action might be what is required when responding to a crisis. We often have to act kind of impulsively to get things done in crisis situations, to care for other people and ourselves. It could also come in handy when trying something beyond one's comfort zone. Harmful impulsivity is associated with pervasive, developmentally inappropriate, and undesirable rather than desirable outcomes. So, spending some time talking to clients about how impulsivity can be beneficial at times, and maybe even exploring the ways that impulsivity has helped them in the past, is a helpful place to start as well. But of course, as we've learned, while useful sometimes when it has undesirable, harmful consequences, we definitely want to get to the bottom of it and create a treatment plan with them so they, can live more effective lives. So here are some examples of impulsivity, and I'm not going to go into detail about them, but I at least want to list all of them that I included here. This is by no means a comprehensive list. This is just an example of some, but I think it really demonstrates in a helpful way what a wide range of examples are included under the umbrella of impulsive behaviors. And some of them you might notice as I get to them, you might not have realized for your clients or maybe even for yourselves that, oh, yeah, that's an impulsive behavior. I didn't realize that, the root or the core of that was impulsivity in the moment. So first, let's see here, abruptly changing or canceling plans, an inability to remain still, binge eating or drinking, being easily distracted, destroying property, escalating confrontations, frequent emotional outbursts, inability to receive criticism without affront, jumping to conclusions, meaningless or risky sex, over apologizing, oversharing of emotions, overspending, physical violence, quitting a job suddenly, self-harm, threatening to harm self or others, always saying yes, shopping, gambling, or spending habits, interrupting, lying, stealing, acting out aggressively, difficulty waiting your turn, erratic driving, joining and quitting a lot of groups, moving quickly from one task to another, or regularly getting into arguments. As you can see, such a wide range of behaviors included under this umbrella. A couple of the ones that really struck me as interesting when I was first starting my research and training on these topics would be the more interpersonal habits that come up for people, like the interrupting or the oversharing. I didn't realize at the time that those both, for some, have roots of impulsivity. All right, so let's look at the risk factors for impulsive behaviors. Age, so younger people are more likely to engage in impulsive behaviors than older people. There's sex, boys and men tend to be affected by impulsivity more frequently. Family history, so a family history of mental illness or impulsive behavior can lead to an increased risk. And then, of course, trauma. Exposure to trauma, violence, abuse, and neglect may increase a person's risk for impulsivity. And then there's substance use. So using drugs and alcohol can contribute to impulsive behavior. One note on that, this is true for really any sort of symptoms or diagnoses, but these risk factors, that increases the likelihood, but all different kinds of people, regardless of sex or age or family history or trauma, can experience issues with impulsive behaviors. And just because you're at a high risk factor or likelihood to experience them does not mean that you will. All right, so let's look at the DSM for a little bit. Impulsive behaviors are linked to the following conditions. There are just so many. I had a hard time figuring out exactly what angle to take for this presentation, just because I could spend several hours talking about how impulsivity affects each of the following diagnoses. But instead, I'm trying to approach it from a more generalized angle, knowing that I only have an hour to spend with you. So we are going to talk about some of the DSM diagnoses and spent a shorter amount of time on the DSM and a lengthier amount of time on some of the interventions that can be utilized regardless of the diagnosis. And again, we'll get to that in a little bit, but we're going to talk about some of the diagnoses today and then get into the interventions. So impulsivity is linked to anxiety disorders, autism spectrum disorders, substance use disorders, PTSD, ADHD, bipolar disorder, antisocial personality disorder, borderline personality disorder, eating disorders, and then ICDs, the impulse control disorders, which include intermittent explosive disorder, trichotillomania, kleptomania, pyromania, pathological gambling, and then there are some other specified and unspecified disorders as well. So again, this is why even defining it is really difficult. Understanding its origins is really difficult because this is a symptom of all of these different diagnoses. So a proper understanding of how impulsivity is affecting the client is critical in being able to treat it effectively. Impulsive behaviors are not in and of themselves a diagnosis. They're more commonly characteristics of other conditions. So again, they're symptoms of a larger diagnosis, and it's not the behaviors themselves that are considered impulsive are not diagnoses in and of themselves. I wanted to elaborate now on a point I made previously. Impulsivity should not be confused with a compulsion, in which a person recognizes the behavior is abnormal but cannot stop it. With impulsivity, the person will act out inherently recognizing that the behavior is abnormal. Or yes, without inherently recognizing. So they act before they can even recognize that what they're doing might be harmful or negative or potentially inappropriate. Also, medical considerations should always take place prior to a diagnosis, including impulsivity. For example, things like traumatic brain injuries, TBIs, Parkinson's, etc., could look like impulsive behaviors. And that would just completely alter the course of treatment if that was the origin of some of their impulsive behaviors. So if that's a consideration or a thought whatsoever for any of the clients that you're working with, absolutely recommend a thorough physical examination prior to, getting into any of the more psychological possibilities. Just make sure they get that medically checked first. All right, so let's talk a little bit about assessment instruments and different ways. Now that we've identified, all right, impulsivity can look like a lot of different things and come from a lot of different places. How can we assess to make sure that we are getting an accurate understanding of a client's impulsive behaviors? These are the three instruments that I've used in the past that, at least in my experience at the various practices I've been a part of, these are the three that I've heard most commonly. I've used all three. The one in particular that I use more so than any of the others that is my personal go-to would be the third one, the UPPSP. But there are three that I'll include in today's presentation. There's the BIS-11 and the I-7. But again, today I want to spend the most time on the UPPSP. In all three of these scales, responses are gathered via the client's self-reporting. So it will come just through talking with them during your sessions and asking them pretty specific questions, and then relying on the feedback that they give you in order to complete the assessment. If for whatever reason their self-reporting does not align with some of the things that you've assessed during your time with them, there are some cognitive tasks that you can give them in real time and kind of explore for accuracy together in the moment. But most of these responses will come from the answers that the clients give you to the questions that are asked of them. Okay, so the UPPSP Impulsive Behavior Scale. This is a 59-item self-report scale. It can be used with adults or adolescents to identify the separate personality facets that have been previously lumped together under the term impulsivity. And this is why I love it so much. It's used with clients who display impulsivity in a variety of settings, including in the context of drug and alcohol abuse, gambling, risk-taking behaviors, problems with sustained motivation and attention, and ADHD. So like we've already discussed, there's a pretty lumped together definition of impulsivity. And the UPPS really helps break it down into different categories. And once we better understand which category they fit into, then we can help treat it properly. The scale is important in understanding the reasons why individuals engage in impulsive behavior. For example, if two individuals engage in the same behavior for different reasons, like gambling to distract from negative emotions versus gambling to sustain a positive emotion or a positive experience, they are likely to respond differently to treatment. So you'd use a completely different set of interventions depending on the reasons why they're engaging in the behavior in the first place. And this scale helps get to the bottom of those things. All right, and here's how they do it. The UPPSP has 5 different subscales. So negative urgency, positive urgency, lack of premeditation, lack of perseverance, and sensation seeking. So with negative urgency, that one refers to the tendency to experience strong impulses under conditions of negative affect. So there are several different examples that could fall under all 5 of these categories, but for negative urgency, think self-harm when extremely distressed. Strong impulses under conditions of negative affect. Positive urgency, the tendency toward rash action in response to a very positive mood. So for that one, you can think of gambling, for example. Perhaps somebody's at a slot machine and wins a little bit of money and is feeling good and continues on without giving it much thought, kind of chasing the high of that initial win. And again, there are so many different examples I could list for all of these, but we just don't have enough time for that today. Next is lack of premeditation. So that is the tendency to fail to think and reflect on the consequences of an act before engaging in that act. And then that one I think speaks for itself. Lack of perseverance. That's difficulties remaining focused on a task that may be long, boring, or difficult. So this one is more of the one where we start to see some of the attention components come in, attention difficulties, ADHD possibilities. That's where we see some of this. And also consider for a moment tasks that may be long, boring, or difficult. Those are all 3 kind of different things as well. So is it the length of time that is challenging for the client? Is it just a lack of interest? They find it boring that is contributing to the difficulty in their focus? Or is it because it's really hard and it's difficult, so they check out rather than, powering through in that specific task? So consider those 3 components as well when you are considering the lack of perseverance subscale. And then lastly, there's sensation seeking. And this one's been really interesting to work with. Sensation seeking, the tendency to enjoy and pursue exciting activities, or an openness to trying new experiences that may or may not be dangerous. So think of things like cliff jumping and activities like that. All right, so after you go through the 59 questions with the clients and they answer, scores will be presented for each 5 of the subscales, plus a total impulsivity score that they'll give you in general. The mean is calculated for the items on each subscale from 1 to 4. So 1 indicates that the client did not endorse impulsive behaviors, and 4 indicates a high level of self-reported impulsivity. So each of the 5 subscales will be ranked from 1 to 4. And then of course, the ones that they're scoring 3 to 4 on, those are going to be the highest likelihood of, that's kind of the why behind their impulsive behaviors. And then the 1 to 2, those are very low. More on all of that in a minute. Okay, we are going to get into the subscales a little bit more in a minute, but before we get into interventions, I did want to talk through treatment modalities a little bit. Research indicates the highest success rates in managing impulsive behaviors occur when utilizing, usually it's a combination of both cognitive behavioral therapy, CBT, and dialectical behavioral therapy, DBT. A lot of the research explores cognitive behavioral therapy more thoroughly than DBT still at this point, but you can see interventions from both modalities utilized pretty interchangeably throughout treatment for impulsive behaviors. In cognitive behavioral therapy, CBT, you are helping people determine their behavioral triggers and learn strategies to manage their responses. And then in dialectical behavioral therapy, DBT, you're helping people learn to tolerate the discomfort of the moment, which means tolerating internal experiences such as emotions, physical sensations such as agitation and restlessness and urges. The best treatment method and interventions to use is the one or the combination of the two that targets the UPPSP subscale in question, or like the top one or two, depending on how your client scores. All right, so I'm going to break it down and go through all 5 of the subscales and then some of my most commonly used interventions for each. There's a plethora for all of them. The ones that I included in the presentation today are just the ones that have been more tried and true for me in my professional experience so far, but a lot of additional research has been done on each, and I included the references for this at the end of this presentation if you're interested in looking into any of them in more depth. But these are the ones that would be my go-tos when treating impulsive behaviors. So we will start and do a time check real quick. Awesome. Okay, let's start with negative urgency interventions. And again, negative urgency is acting rashly when distressed. The first thing we'll want to do with a person who tends to act impulsively when they're extremely upset about something is identify and practice healthy coping skills. So it's a possibility that when they're upset, they will do whatever it takes to cope with the pain and discomfort of the moment. So helping them increase their bank of coping skills can be really effective for folks that find themselves struggling with this. Also, help them build in time to stop and think so they can respond instead of react. Oftentimes when people are distressed and behaving impulsively, they want to get rid of it as quickly as possible. So this one can be extremely uncomfortable for them, which is when DBT can come in really handy, or some of the DBT skills anyway, I should say, because it helps them build in time to stop and think, tolerate the discomfort of the moment so that they can learn how to respond to what they're facing instead of react to what they're facing. Then next, it's really all about calming emotions, and the following is one of the DBT skills. It's you can calm the emotions with temperature, intense exercise, paced breathing, and progressive muscle relaxation. If it's truly an emotional dysregulation issue at its core, helping them calm those intense emotions is extremely important. Next is urge surfing. This one's one of my favorite ones to use. I find it applicable in really almost all of the subscales, but this one in particular seems to come up pretty much every time. Urge surfing, it's practicing ways to accept urges and ride them out without giving into them. Research has indicated that the approximate with an average urge, it lasts approximately 30 minutes. There are a lot of different urges of a lot of different kinds, some that will last far less than this, some that will last a little more than this, but research has kind of given us this 30-minute window that we can work with our clients, which is extremely helpful because in the distress of the moment, it feels so much bigger than 30 minutes. It feels like an impossible mountain ahead of them that they are just absolutely unwilling to face. But if clients know that, all right, I've got to figure out what to do for the next 30 minutes until the intensity of this urge can pass, that feels more doable to them. And it just instills some hope that they can kind of overcome some of the issues that they've been facing. So practice ways to accept urges and ride them out without giving into them. If you are successfully distracting yourself or doing other things for approximately 30 minutes, the urge will pass on its own. And that is really empowering. A lot of people are under the negative assumption that in order to get this urge to go away, I have to act on it. And we know that that's just not true. So some psychoeducation for the client about that can be really empowering for them. Next is just basic problem solving skills. So depending on what is causing the distress, if something has taken place, there are likely a lot of other options other than engaging in the problematic behavior that they've been engaging in. So helping them kind of explore with curiosity the situation that they're in when they do feel distressed, and are there other options available to you rather than doing X, Y, or Z, can be very helpful. And every client's, I shouldn't say every, many clients' least favorite intervention is this last one. If possible, explore ways to prevent the suffering. Um, it can still be a really important one to discuss with clients, even though it can be a hard one to discuss with clients. Are there ways to avoid the distress you're under in those situations? Is it a toxic relationship? Uh, is it a job that you need to transition out of? Is there a way to prevent the suffering, the distress you're experiencing when the impulsive behaviors occur? Those can just be hard conversations for folks. All right, next is positive urgency and positive urgency interventions. So this is acting rashly when experiencing positive emotions. First thing we want to do is identify the maladaptive behaviors associated with continuing to act rashly when you're feeling really positive. This isn't always the case, but kind of think mania, or when a person is, displaying signs that they're a tad manic for various reasons. It's kind of decisions that clients make when they're in that mental and emotional place. So it's helpful to identify with them the maladaptive behaviors that take place when they're feeling that way. Some common examples include risky sexual activity, gambling, shopping, and substance use. And then once we can identify the maladaptive behaviors that they typically go to when they're experiencing extremely positive emotions, we can then help them identify the costs and benefits associated with these behaviors. And this kind of ties back into the quote from the very beginning. People often fail when they focus on the things they want now instead of the things that they want most. So helping them identify the costs and behaviors associated and recognize, while this is something they might really want to do in the moment, that seems like a great idea in the moment, there's a very strong likelihood that there's something else that they want even more. Next, set boundaries and limits when emotionally regulated. So once we're in that heightened place emotionally, it can be really hard to set boundaries in those moments and then hope that we follow through with them. So instead, when you are not experiencing urgency, when you're in a positive state, wait until you're kind of in an emotionally regulated state. And whether through therapy or through their own personal work with themselves, set some boundaries and limits when you're thinking more clearly. And then in doing so, create safeguards to prevent the maladaptive behaviors. Because again, you might know that it's not something you want to do, but with impulsive behaviors in the moment, a lot of that goes out the window, and you're kind of in this situation anyway, riding a high a bit. So for some people, even after identifying the costs and benefits associated, they still need something else, at least for a time, to help modify these negative behaviors. Some limits include one, a credit card limit of $500. For example, if it's shopping or gambling or even substance use or risky sex, credit card limits can be really, really helpful for people in those moments, that no matter what happens within a 24 period of time, unless previously discussed with your bank, you can only spend $500 at a time. I've seen this help so many people in the heat of the moment to keep from absolutely destroying their financial situations impulsively. Another idea might be removing access to substances, whether that's removing the contacts from your phone of people that you reach out to access drugs, moving sometimes, talking to people that you have previously accessed these things from and asking them to not sell them to you, things like that, just removing access. Throw away any additional things that you've been storing in any cabinets or things like that. Remove all access so that in the moment, it's not available to you to use. Another idea, remove dating apps and partner contacts, and then restrict internet access. So these are all things that what you're doing is you're helping the client make it harder for them to act out in negative, impulsive ways. I had a client so devoted to this particular intervention that, based on the impulsive behavior they were trying to limit or stop, they ended up taking the door completely off of their hinge. They thought, if anybody has access to me in my bedroom at any time, I am much less likely to engage in some of the things that have caused me issues previously. And it was really effective. So those are just some ideas, some safeguards to prevent the maladaptive behaviors. All right, we're doing great on time here. The next is lack of premeditation interventions. So the lack of premeditation refers to the tendency to fail to think and reflect on the consequences of an act before engaging in that act. So interventions for this one include identifying the behaviors and situations that continue to cause unwanted consequences. A lot of times that work hasn't even been done yet if this is the subscale that they've been struggling with. So it's helping them identify, okay, what are the patterns? What are the things in your life that are not going well right now? And they're able to identify certain behaviors that they exhibit or certain situations that continue to be present around the time that these maladaptive behaviors occur. And then after they can identify some of these behaviors and situations, here are some more DBT skills that can be really helpful. There's the DBT stop skill. So it's stop, take a step back, observe, and proceed mindfully. Cost benefit analyses can be really helpful for premeditation as well. So just now that they've identified the situations that cause them trouble, working with them through saying, okay, these are the ways that this is not helping me, this is harming me. In the moment, it seems like it might be helping, but here's what it costs me afterwards. It's just helping them look into the future a little bit more. So even if it's in the very near future, it doesn't have to be long-term future, but if I do this right now, what will my life be like 15 to 20 minutes from now? For example, if you um, explode at a coworker rather than using some basic problem solving skills, you might get written up, you might get in trouble with your boss. How many times has this happened? Are you at risk of getting fired? In the moment you're just feeling angry, so you might snap at a coworker. But if you can be a bit more future thinking and recognize, if I do this right now, it's going to cost me my job, you might over time learn how to make some different decisions in the moment. And on that note, the next intervention is the values clarification exercise. This can be extremely helpful. And again, it's about recognizing that while these things are behaviors they want now, there are likely things they want even more out of their life. So going through a values clarification exercise where clients are challenged to think of the 3 to 5 things that are more important to them in their life than anything else, it can help them just kind of clarify in the moment the things that they do and do not want to do, things they want to say and not want to say. Keeping those values kind of at the forefront of their mind can help them in the moments when they're faced with something they want now, and kind of empower them to persevere towards the things that they want even more. And then there's the CBT behavior chain that can be very helpful. So a lot of what we're talking about is interventions that they can do in the moment. But over time, it's even more helpful if they can start to pick up on things that are occurring even before the moment. So what are the thoughts that are already in their head that are leading to some of those behaviors? What are the thoughts? How is it affecting their behavior, et cetera? And how can we then reframe those thoughts in order to get to different behaviors? And then next is consultation. So even creating some kind of a pact with your client that in these situations moving forward, is there a trusted person you can consult with? I've even made, little deals with my clients where I will say, if and when this occurs this week, wait until our next session. Let's chat about it first. Let's talk this through first. And if you still decide afterwards that that's the right course of action, maybe you do it. But let's at least agree to wait, talk to me about it first, and then decide on what you want to do. And that alone mitigates a lot of the negative impulsive behaviors entirely. And it doesn't have to be with a therapist. It can be with a family member or a friend or anybody trusted in the person's life that they'll say, next time I'm in that situation, I am just going to commit to myself. I'm going to call up so-and-so. We're going to talk about it for 15 minutes and see if I come up with a different conclusion after that, after thinking through it a little bit more thoroughly. All right, so now it's the lack of perseverance interventions. I'm going to take a quick drink. Thank you. So with the lack of perseverance, these are difficulties remaining focused on a task that may be long, boring, or difficult. So again, think of those issues with attention and focus, similar to possibly, ADD or ADHD. Some interventions that can be helpful and maybe not as significant or severe as something that would warrant, an ADHD diagnosis either. That's just an example. So depending on the task at hand that they struggle with, breaking it up into smaller, more manageable components can be helpful. So whatever that may be, if it's a length situation and it's just hard to persevere on something that boring or that hard for that long of a time, breaking it up into smaller, more manageable chunks throughout the day can be a lot more effective for people than trying to tackle it all at the same time. Next is set timers. So having the client set timers for themselves where they can commit to focusing on that specific task for maybe 15 to 20 minutes at a time. Maybe it's even less than that, 5 to 10 minutes at a time too, whatever the client can tolerate, and then you can increase that over time. But setting timers where they can say, I'm just going to do this for a set amount of time at various points throughout the day or the week. Next would be scheduling in breaks for themselves. So this kind of goes in line with even breaking it up into smaller components or setting timers in the in between. Make sure you're taking a break, doing something that re-energizes you, and gets you ready to kind of focus in the next time, that timer goes off and you're ready to focus again. Next would be positive self-talk. A lot of clients that struggle with lack of perseverance, impulsivity issues are pretty down on themselves. And when you ask them about some of those thoughts and self-esteem things, they feel very incapable, very inadequate, like they're lacking something or not very smart or not good at this. And that self-talk can be pretty, it can either keep them stuck in the lack of focus or lack of attention, or it can encourage them along the way. So working on helping them identify any negative self-talk and replacing that with positive self-talk in the moment. Next, intermittent completion rewards is always great. So after, your client has set a timer and focused successfully for 15 minutes or whatever set of time they have identified for themselves, building in little rewards throughout the day. So that can mean a lot of different things depending on your client, but little things that they can do, even if it's multiple times during the day or at the end of every day or at the end of a week, wherever they're at, as a way to reward themselves and focus on the things that they've done well. Also, helping them remind themselves of the why the task is important. Is this important in order to pass the test or get to the next grade or keep your job? I have to do this boring, difficult job or whatever the client's facing because I need to provide for my family. Like it's as basic as that for some people. Like this is essential for me to do so I can provide for my needs. Helping clients remind themselves of the why can help them persevere in the moment. Also, I like this one a lot, being intentional with their environment. This goes completely ignored and unrecognized for many, many people. But is there something environmentally, spatially, something sensory about the environment that they're in that is making it difficult for them? Is it too hot, like where they're at? Is it too cold? Are there too many distracting elements around them? Is it cluttered? Does it not feel peaceful? Is there too much noise? A lot of different things that could be going on that contribute to a person's difficulty remaining focused. And on that note, increase or decrease outside stimulation to increase focus. So there are a lot of different things that, depending on what a client can come up with that makes this challenging, that they can implement to improve their situation. For example, wearing headphones while completing assignments or completing work projects. Fidget spinners can be really helpful to increase focus. Sometimes it's all about kind of the ambiance in the room, that if a person makes some adjustments to their office or to their home space or to their workspace or school space, it can make a a very surprisingly big difference for some people. All right, and then next are the sensation-seeking interventions. So sensation-seeking, again, that's the tendency to enjoy and pursue exciting activities and or an openness to trying new experiences that may or may not be dangerous. So again, that cost-benefit analysis is huge because so much of impulsive behaviors are things that are hurting other people that you don't realize are hurting other people, or unwanted consequences in the future that in the moment you're having trouble focusing on. But with the sensation seeking interventions, it's a cost benefit analysis. So the sensation seeking behavior, whatever that may be, sometimes it's overtly unhealthy, and then sometimes it's not necessarily an unhealthy thing to do. If you've looked at some of the other factors involved, think of like extreme sports and things like that. Oftentimes these are well researched. Lots of safety precautions and safety measures go into many of the thrill seeking activities that people explore. That's different than impulsivity. Those are things that are well thought through before. But there are some more extreme sports that are a little less safe, that have a tendency to cause issues for people. And that's just one example. Again, there are many examples, but helping them weigh the cost benefit analysis. So the thrill of the rush is an obvious benefit for sensation seekers, but then what might it cost you? And is that worth it? And sometimes for clients, they'll tell you it's worth it to me. The benefits are worth the costs involved. But in that situation, as long as they've fully thought through it and the sensation seeking isn't being done impulsively, that's what matters most. Next is to explore some harm reduction strategies. So during that cost benefit analysis period, if you can help them explore ways to make some of the behaviors they engage in for sensation seeking safer, that can be really helpful too. And again, there's a myriad of applications for that depending on what their sensation seeking behavior is. I'm trying to think of an example that might be helpful. Well, I guess we haven't talked about substances much. Maybe we can apply that to substance use. So if there's a sensation seeking kind of thrill involved in, potential drug use for clients, illegal drug use, some harm reduction strategies, researching it with them, researching the specific drug, looking at that cost benefit analysis. Is there any way to do this a little bit more safely than the ways they might be doing it? That would be an example. Next, explore safe excitement alternatives, AKA the rush without the risk. So are there any, if for them impulsivity is purely about the thrill, are there any things that they could do that accomplish that for them without all of the costs associated? So again, they can get the benefits without the costs. I hesitate to go too into detail about a really specific behavior at the risk of it not applying to a presentation that's supposed to be pretty general in nature. So I'm trying to keep myself from using personal client examples too much that might not apply at all to what you might do with your clients. So thanks for your grace as I'm thinking through some of that. Next would be to consider new exhilarating hobbies to stimulate that fear reward network of the brain. That's really similar to the safe excitement alternatives, but this kind of incorporates more psychoeducation for the client. So there's a fear reward network of the brain that is highly stimulated in those environments. Sometimes it's the fear that is contributing to the rush. So are there things that might be scary, like things like scary movies? This is a really good one to swap out for other unsafe activities that people do, just to see if it had that same effect for the clients. So is there something about the fear of being scared and then realizing you're safe after all, or you experienced it with friends and it was just kind of a funny, bonding experience together to watch that scary movie or go to that haunted house or something like that. And again, lots of different hobbies to choose, but these new exhilarating hobbies, and consider how it's stimulating the fear reward network that seems to be so desirable for clients in these situations. And again, you can channel it in positive ways too. So there are very obvious negative ways to sensation seek, such as drug use, um, a lot of risky sexual activity, but there are some positive ways as well. And then clearly set boundaries. And again, the cost benefit analysis is so key for everything that follows, but setting boundaries to try to reduce the risk, mitigate the harm, incorporate other hobbies that don't, you know, cause so much potential harm to the client, etc. All right, so those are the sensation seeking interventions. Next are the medication considerations. So the majority of the clients that I've worked with that struggle with impulsive behaviors have gotten a evaluation done and are on medication of some kind in conjunction with treatment. And there are a number of drugs that can be used to help treat impulsivity. There's a lot of interesting research out there about whether or not these drugs are targeting the impulsive behaviors specifically, or if they're just doing other things in the body that have a positive effect on the impulsivity. It's kind of hard to know, but these are the ones that I've worked with clients who are using, as well as some of the research I have done online about some additional ones that people utilize in more non-traditional impulsive behavior situations. There are, obviously the SSRIs, the selective serotonin reuptake inhibitors, mood stabilizers, believe it or not. The Lamictal may help reduce impulsivity and anger, while Topamax may decrease impulsivity, anger, and anxiety. So those mood stabilizers are fairly common, at least with the clients that I work with. And then there's atypical antipsychotics. These are more rare, but things like Abilify have been seen to reduce interpersonal problems and impulsivity. And then various ADHD medications. And medications are most effective when used in conjunction with psychotherapy with a therapist who specializes in treating impulsive behavior. So a lot of times it's a combination of the both. And if clients are hesitant about using medication, there are still things that we can try. Any of the interventions that I just went through, let's try them and see how you respond. And if none of them are working, or that the impulsivity is so strong that they might change their minds over time about an evaluation with a psychiatrist, simply because they realize that even in trying to intervene, I'm just still having trouble. So be patient with this portion when you're working with clients, just because people have a very wide variety of thoughts towards medication use. But of course, many of us aren't the ones that prescribe that medication ourselves. Most of us anyway, would refer out to somebody that can, and all of the information about whether or not they would qualify or if they need it should be done with that specialized professional. On that note, I will say I have worked with a few psychiatrists and shared assessment scale findings that they may or may not do on their end of things. So again, depending on the subscale that the client is most affected by, that could be really useful information for a psychiatrist. So working with them as a team can be really helpful in making sure that the client is receiving the most accurate medication. All right, so this is just kind of one final note about treatment for managing impulsive behaviors. It's definitely a process that takes time, practice, and patience. So even from the beginning, the assessment phase is so lengthy, just trying to figure out, okay, what are these specific behaviors? Where has this, negatively impacted your life, and why? Where did some of these things come from? Why might you be engaging in the behaviors that you are? It just takes time. Utilizing the UPPSP assessment really does help cut down on that time. But still, even after you have that, it's just making sure you have a really thorough understanding of the behaviors themselves and what's causing them. That is the most crucial step. So I think equipping clients with that knowledge going in can be really helpful. This is a process that includes increasing self-awareness, building new thought patterns, increasing coping skills, and implementing lifestyle changes that can help equip them for the road ahead. So lots of different kinds of interventions where it's a trial and error thing, and not like any other diagnosis, not every intervention is going to help. And then you might have to try other things. And that's a normal part of the process. They might even experience things improving for a while and then, you know, spiking again and again. That's a normal part of the treatment process as well. But no matter what its cause, impulsive behavior can be addressed and often managed through therapy, medication, or a combination of the two. This is definitely, these are pervasive issues in people's lives that have very real treatment possibilities. And that can be helpful for them to hear. There is hope. You can, over time, learn to address some of these unwanted behaviors. These are the references that I used for this presentation. So feel free to check out any of those in particular. The second bullet point there I want to point out, that is the actual UPPSP impulsive behavior scale. That will explain a little bit more about it too if you're looking for a more lengthy explanation of the scale. And then you can also find the actual assessment there as well. All right, if you have any questions, feel free to reach out. I included my email, jerry@kcresolve.com. I really appreciate your time today. And yeah, enjoy the rest of the Care4U2 conference.